I'm going to show you what kind of instruments you would need for an apicectomy. An apicectomy, as you all know, is a surgical procedure which involves cutting off the apex of a tooth and removing any infection around it. In the exam, you will be asked to set up instruments for different procedures, and an apicectomy might be one of them. When you set up instruments, it is always a good idea to lay them out in the order in which you would use them. So this means that you have to think through the procedure in your head and try to think, what instrument do I need first, second, or third? Of course, when you're doing it in the surgery, this is all done using gloves, masks and goggles, so full PPE, and of course a sterile or a very clean environment. So always, as with any treatment, you will need your basic set of instruments, which is your mirror, your probe, and your tweezers. Then, because this is a surgical procedure, we will need to numb up the patient, so we'll need to give them local anesthetic, and for this we need a local anesthetic syringe with a local anesthetic cartridge and needle. In this case, this is a bridge syringe which opens like this, so you pull it all the way and gently twist to the side. The cartridge goes in like this, then you close it, and this is a needle. It has two caps. You take off the short cap and you screw it in place. In most cases, all you will have to do is make sure that the dentist has the syringe, the needle and the cartridge ready, and usually the dentist will be the one to set it up. So this is your local anesthetic syringe with cartridge and needle. The next instrument that we need is a scalpel holder, and this instrument is used to hold the scalpel blade. Again, what you have to do if you're doing this in the surgery is prepare everything and leave it for the dentist to put on. So this is a scalpel blade, and it goes onto the scalpel holder like this. Of course, it is best to be doing this with some sterile needle holders. It clicks into place, and this is a scalpel holder and scalpel blade. It is not a good idea to leave it lying around. You have to put it back in the packet, but best leave it for the dentist to do. Just make sure that you have it ready. So with this instrument, the dentist is going to cut the gum, and after the gum has been cut, he has to use a periosteal elevator to pull back the gums, because what we want to do is we want to expose the bone so that the dentist can drill in the area over the apex of the tooth. So we pull back the gum, or we raise a flap with a periosteal elevator. The next instrument that you need is an Austin retractor. So you can use this either to retract the cheek or the tongue, or you can use it to retract the gingival flap. So this area can be placed over the area of the incision, and you can pull back the gum with this part of the instrument. So this is the Austin retractor. So once the gum has been pulled back and the bone is exposed, the dentist can use a straight hand piece with a burr. A burr that can be used is one of these, and this is called a straight handpiece round steel burr. This would go on the straight handpiece, and with this the dentist would remove the bone over the apex of the tooth. Then, once all the bone has been removed and the dentist is able to see the apex of the tooth, he's going to use a fast handpiece with a diamond burr to cut off the apex. He might use this instrument to remove it. This is called a Mitchell's trimmer, and you'll see that on one side it's quite sharp and pointed, and on the other side it's like a little spoon which can scoop out and remove any soft infected tissue. So this is the Mitchell's trimmer. After the apex of the tooth has been removed and all the infection has been cleared out with the Mitchell's trimmer, what the dentist has to do is place the gum back into its original place so that it can be sutured. For this, he can use this instrument. This is called tissue dissecting forceps, and these forceps are used for holding soft tissues. In this case, it would be the gums. Once the gums are back in their original position, the dentist is going to use this instrument, which is the needle holders, with a suture needle and silk. He's going to clip the needle with the needle holders and place the stitches into the patient's mouth. And the last instrument that you would need is scissors to cut the sutures after the dentist has placed the stitches in the mouth. You have to make sure that you have a surgical aspirating tip connected to the chair, as well as a mouth prop, which might be quite useful if the patient is getting tired and if they have a problem opening their mouth wide. So this would go into the patient's mouth, something like this, between their upper and the lower teeth, and they can rest their jaws and keep their mouth open for long periods of time. So this is your mouth prop with chain for health and safety, to make sure that if the patient starts to swallow it or starts choking, you can pull it out quite quickly out of the mouth.